My name is Dr.Zimin. I'm a founder of DRZIMIN.CM and naturopathic doctor and physician. And today I'm gonna talk about this very important herb, Phlojodecarpus sibiricus. So we know from this that it's herb from Siberia. So pot use, root, and mechanism of action is related with alkaloids. Of course, alkaloids, they have such broad spectrum of indications of very beneficial effects. And in this case, alkaloids don't regulate level of estrogens. And the second point is alkaloids have anti-tumor effect. Of course, under these conditions, I mean that it has not proper anti-tumor effects like a chemotherapy, anti-cancer effect. But when we take Phlojodecarpus sibiricus, we minimize the side effects of chemotherapy. And we also minimize the metastasis in organism in cancer conditions. So very crucial, very important things to know. Okay, let's jump into indications for this herb. So first of all, ovarian cysts. Ovarian cyst is a fluid-filled growth in ovaries. It can be in one ovary or in both ovaries. They can grow and then rupture, so a lot of mess. So a conventional treatment is always associated with taking birth control pills, but we should keep in mind that birth control pills have such side effects like thrombophlebitis. The second is hepatotoxicity, so a lot of things that are not beneficial for health. So the next indication, uterine fibroids. Uterine fibroids is a benign tumor and it can be stimulated by estrogen, and moreover it can be stimulated by metabolites of estrogen and xenoestrogens. Because we have such bad environmental situations, so a lot of toxins in food, in air, in water, and all this burden of toxins, they can stimulate the uterine fibroids. That's why we use this herb. So the next is female infertility. It can be both. It's because of hormonal imbalance, and the second is because of inflammatory conditions in ovaries. And a fourth indication is varicose disease, because alkaloids can be very beneficial in varicose disease. And of course, we should talk about preparation. The first is decoction. 1:50 ratio is a good ratio for an effect. So the next is very important to take this herb before meals, 15 minutes before meal. Why? Because when we take before meal, the bioavailability is increased. So the next, we should take this herb 3 months, because when we tackle the endocrine-dependent pathologies and clinical situations, and especially in gynecology, there should be 3 months minimum, and from 3 months to, for example, 1 year duration of treatment with this herb. So the contraindications are pregnancy, breastfeeding, all these endocrine-dependent conditions, and atonic constipation because of alkaloids.